So, for the case. So we present a case of a patient with very few symptoms, if any, and none of the pathognomonic findings of tamponade. A high index of suspicion and prompt diagnosis of her condition resulted in appropriate therapy and saved her life. So this is the case. Would anybody like to volunteer to read it? So many volunteers. Yes, ma'am. I'll read it. So, a 53-year-old woman with a medical history of diabetes, hypertension, and chronic obstructive pulmonary disease presented to the emergency department with complaints of chest discomfort. She stated that she was traveling from North Carolina to New York for a couple of days by car. And she stated that she began to experience this quote-unquote chest discomfort when she was driving through Delaware, which is approximately 188 miles from her final destination in New York. She presented to the emergency department in Delaware with complaints of this chest discomfort. And as per the discharge summary from the hospital, the patient had a workup that included a CT pulmonary angiogram of the chest and a CT of the abdomen, and was discharged with a diagnosis of GERD, gastroesophageal reflux disease. An echocardiogram was not done. Later that day, the patient arrived to our emergency department here at St. John's Episcopal Hospital with the same complaint of chest discomfort. She described her chest discomfort on and off, located on the left side of the chest, tender to palpation. 7 out of 10 in intensity, non-radiating, not associated with shortness of breath, and not related to change in position or respiration effort. She denied the use of cigarettes, alcohol, and illicit drugs. In addition, she denied fever, chills, cough, nausea, vomiting, and abdominal pain. The patient's physical exam vital signs and lab tests, CBC, biochemical profile, etc., were all normal. The EKG showed normal sinus rhythm with normal intervals at a rate of 98 beats per minute. In addition, the EKG showed mild electrical alternatives with some PR segment depressions in leads 1 and 2, and I'll show you that here. So when analyzing the EKG, first you look to see if there's, look at the rate. The rate here is approximately 100. It was 98, that's the machine read. There's P waves, so it's in sinus rhythm. There's some segment depression here with the PR segment depressions. The axis is a normal axis. If you look at leads 1, ABF, and 2, it's a normal axis. So